I'd like to welcome Dr. Yoshikazu Sato as the first speaker and as a theme of the current status and the future Japanese of ESWL in Japan. Career in the Department of Urology, and from 1997 to 2000 studied abroad at the Albert Einstein College of Medicine. After the assistant professor at the Sapporo Medical University from 2015, he is the director of the Sanjukai Hospital.
I would like to talk about the current status and the future challenges of ESWL. The case of TUL dramatically increased over the last 2 decades. On the other hand, the case of ESWL has continuously decreased. My talk has 3 parts. First, current evidence on ESWL versus URS. The second, view of Japanese urologists for ESWL. Finally, future challenge of ESWL. Let's move to our first part. We can say ESWL as a safe and effective option. Based on this evidence, we can choose ESWL as a safe and effective option based on its advantage and disadvantage with considering individual patient circumstances and preference. So, what do Japanese urologists think about ESWL and its pros and cons? In the second part, I will present opinion of Japanese urologists on ESWL using Donia seminar participant survey. 80% of participants, 80% of urologists answered choose ESWL. So Japanese urologists love ESWL. Last part, I would like to summarize these 2 hot topics briefly. The first one is CT texture analysis. The contribution of CT texture analysis as measure of stone heterogeneity, along with as a known clinical factor to predict likelihood SWL success. So texture analysis parameter identify thin lining provided incremental accuracy for predict SWL outcomes. The second one is artificial intelligence and stone diseases. If AI software becomes widely used in the future, it might be useful in the clinical practice for prediction of SWL outcomes. I conclude by following take-home messages. We can choose ESWL as a safe and effective options based on its advantage and disadvantage with considering individual patients' circumstances and preference. Introducing of education of training system is essential for good outcome. Future technology, ESWL itself, image area, texture analysis, analyzing system, AI, may predict outcome of ESWL and optimize patient selection for better outcome of ESWL. ESWL will keep a significant position in active treatment of urologists. And I think the future of ESWL is bright. Thank you for your attention.